Why is it important to become your own best advocate? We at Myeloma Crowd have brought together a whole team of myeloma specialists and patient experts to deliver these videos to you. All the patients you're about to see are myeloma patients and expert patient advocates who have learned the importance of advocating for themselves firsthand. The doctors are some of the top doctors in myeloma, and they are able to see what the best patients do to take control of their care and advocate for themselves effectively. It is so important that you become educated about your myeloma and participate actively in your care. I'll let our experts explain why that's the case.
It's hard when you're first diagnosed with myeloma because you have this disease you never heard of before. Everything's new and you're thinking about every aspect of cancer, like from your finances to your family situation, and it can be really overwhelming. But when the dust settles a little, you're going to start needing to make some important treatment decisions. And to make those treatment decisions in conjunction with your doctor, you're going to need to be as educated as you possibly can. Patients who become their own health advocate, I think, live longer with multiple myeloma. They ask better questions of their doctor in the clinic. They are aware of the different treatment options that are available to them. And because they're advocating for themselves, I just notice how busy healthcare practitioners are. The nursing staff, the physician's assistants, the doctors, they're being asked to do more in less time than they ever have. And sometimes it's just not possible for them to keep track of every little detail for every patient. They are doing great and amazing work, and they are really caring and brilliant people. Just sometimes it's best, if you're going to get the ultimate outcome for yourself, that you self-advocate.
So what are the benefits of being an educated and empowered patient? I can tell you that people who understand their disease cope so much better with what's going on. They have comprehension of what's going on, why it's going on, what the justification is. Educated patients spot treatment-related side effects before they become severe or permanent and are capable of alerting their physicians. Patients who are well educated also have a much better understanding of their options and alternatives, and it makes for a much better partnership between the patient and their provider. The treatment selection for patients should not be one way. There should be a discussion of the various options, and a well-informed patient is in an outstanding position to partner with their healthcare provider to optimize their outcomes with multiple myeloma.
Myeloma is a very heterogeneous, difficult disease. To learn about it, you really have to study it. And to become your own best advocate, you have to know your enemy. The reason for doing that is to make good myeloma treatment decisions. You can work with your doctor to improve your treatment if you advocate for yourself, know what's possible with myeloma treatment, and ask for what you need. Tell your doctor if you're having concerns and problems. You need to be an advocate for yourself. No one understands your health, your situation better than you do.
I was diagnosed with myeloma a long time ago, 1995, and certainly treatments have changed a lot in the last 24 years. I think it's so important to become your own best advocate for that reason. Treatment for myeloma is not a one-size-fits-all. In fact, even for a given individual, there are treatment options. The more you understand about myeloma, the more you understand about your own myeloma markers, possibly side effects that can come, the more and better questions you'll be able to ask your doctor so that together you can determine the next best treatment for you.
What you don't know can hurt you. The more knowledge you have, the better you are at making the appropriate decisions. And it's whether you as an advocate do it or whether you have somebody like a child that takes the leadership role and learns all about the disease. But what I found is that those people who have the most knowledge of this disease seem to do the best. And I think that's probably some of the very important reasons that you need to be your own advocate, because you won't find these things out by yourself unless you do research.